Giovanna Couillard visits her therapist twice a month in Cherry Hill, all the way from her home in Bensalem, Pennsylvania. When was the last time someone has been in your house other than you, your husband, and your son?
It's been approximately 5 years I would let people come into my house.
Recently, her in-laws came, but they had to go through a ritual.
They had to come in, take off their shoes, put on booties, wash their hands. I had to clean their phones, and they were only allowed to sit on the floor and play with my son in his trains, and then that was it. And then they had to leave.
Tell me why.
I have a fear of germs coming into my house.
Giovanna has depression and obsessive-compulsive disorder, OCD, a psychiatric disorder of unwanted, intrusive, and distressful urges, thoughts, or images. Before therapy, she would clean for 4 hours a day, now about an hour and a half. But on Mondays, everybody's out of the house, so she can clean for about 7 to 8 hours. That includes vacuuming the bed, rituals to ease her anxiety to the tune of $300 a month in cleaning supplies.
I dread Sunday nights because Monday mornings I have to get up and I have to clean, and I dread that I have to spend the entire day cleaning.
There's no question that practicing cleanliness is a good thing, but research shows too much of a good thing in this case is a bad thing.
Unfortunately, we've become a very sterilized society to some extent.
At Inglewood Hospital and Medical Center, infectious disease specialist Dr. Ashwin Jathavedam says we're overdoing it, cleaning and disinfecting to our own detriment, destroying some germs and pathogens that build immunities that could help fight infections. And that could be the reason studies continue to find increasing rates of asthma, allergies, and other ailments.
Everything these days tends to be antibacterial. The soaps we use to Purell, detergents, everything is kind of an in vogue thing. And we're finding more and more that these things do contribute to the development of bacteria becoming more resistant to a lot of the antibiotics we use.
But germaphobes would say, but it's clean.
It's clean in one sense, but in the grand scheme of things, it may come back to haunt us.
What do you think of that?
I totally believe that.
Medicine and therapy could help Giovanna and others who obsess compulsively over cleaning.
They're always going to be vulnerable to it, so they might have a stressor come up later on that may exacerbate some symptoms they may have to address, but they can minimize the effect on their lives.
Well, I'll always have it. It's just the way you deal with it.
And the doctor says the same holds true for germs.
Some exposure is not necessarily harmful. We have bacteria are all around us on our skin and surfaces. It's not realistic to expect to get rid of all of them.
Michael Hill, NJTV News.